safe streets, vibrant neighborhoods, successful business and commerce. These are things that make a healthy community. We are a diverse community, rural, suburban, urban, a multitude of languages and ethnicities, ages and experiences. We are a collaborative community. Public-private partnerships make us a model community that others want to follow. It is what makes us unique. It is what makes us strong. The employees of Kent County reflect our diversity and seek to serve our communities.
People in this county, in this area, we wrap our arms around each other. We come together to collaborate, to solve problems. We're all working for the good of the whole. And I think that's wonderful. And you can see it. You can see it as you drive around Kent County.
Our impact starts the day a baby is born and a birth certificate is issued, to protecting children from deadly diseases through vaccination, to the public safety and justice provided by law enforcement and the courts, to offering veterans services and caring for the elderly. Every day we work to keep our communities robust.
I think if you are somebody who's interested in serving your community, in building a strong knowledge base and a good group of people to work with, then the county is one of your best employment opportunities out there. It's been completely rewarding in every way I could possibly explain for 26 years, and I feel like I grow every single day still today.
Leading these dedicated employees, our 19-member Board of Commissioners and our County Administrator Controller, along with our elected officials and appointed department directors, placing emphasis on civic involvement, quality housing, vibrant neighborhoods, and strong, solid infrastructure to allow businesses to thrive. Professional, dedicated, collaborative, and innovative.
Behind the scenes, collaboration between foundations, charitable organizations, nonprofits, for-profit businesses, public sector demonstrated through the county, the city of Grand Rapids, the townships, all the cities and the villages in our area. If we don't come together, then we will not have the strength that we have today, and I only hope to build upon that.
Our aim is to make our communities the best they can be. We are involved in exciting development projects, sustainable recycling programs, and creative progressive prevention programming. We partner with elected officials, impacting policy ideas that become great achievements. We seek opportunities to reach out into the community and offer our services to help our residents make Kent County thrive.
Our relationship is solid, both from a staff standpoint at the county level as well as the Board of Commissioners. And they understand what we do and the benefits that we can do for the community, and vice versa. We couldn't do what we do without the help of Kent County.
While most of us are busy running our lives, Kent County's elected officials, administrator controller, and over 1,600 employees are serving the communities where we live our lives, so we can all have a place we are proud to call home. Kent County, its life well run.
Okay, it's May 3rd, 8:30. Former Chair Corndike said I had it done in 15 minutes, so let's do it. Public comment, please. Is there any public comment? Ma'am, you going to speak this morning? No. Okay.
That was short.
You could have said yes and kept walking too. Okay. No public comment. Let's go to consent agenda. Need approval?
So moved.
Support.
Moved and supported. That's item A, B, C, and D. And anyone care to remove anything from the consent agenda? All those in favor say aye.
Aye.
Those opposed? Thank you. Item 3. Darrell, please.
This is a request to recommend to the board to authorize a summer 2016 general operating property tax levy. Pursuant to state law, a notice of a public hearing concerning the 2016 county budget was published in the newspaper of general circulation on October 25th, 2015, and a public hearing concerning the budget was held November 5th, 2015. The Board of Commissioners adopted a fiscal year 2016 appropriation resolution on November 19th, 2015. The 2016 budget as adopted requires a levy of 4.2803 mils for general operating purposes to be authorized for the 2016 summer tax billing, which has a tax levy date of July 1. Funds derived from the levy of this millage will be used to support the previously adopted fiscal year 2016 general operating budget.
So moved. Approve.
Support.
Support. Questions? David?
Just a comment. I continue to believe that the voters of this county would support us if we were to increase this by the teeny fraction that would allow us to generate about an additional few $100,000 that we could put on preventive maintenance and some of our long-term debt, which would be pretty fiscally conservative as a county. So I'm just, every time we address this issue, I'll just keep making that comment.
Sorry, I lost my microphone there.
So I guess you're not allowed to speak today. So,
No.
but that's the chair's prerogative, not mine. So that's just my comment that I continue to believe that.
Were you gonna swallow that microphone?
No, I just dropped it, sorry.
You don't need to pick it up, just speak clearly. Okay.
Appreciate Commissioner Bolkowski's thoughts. Just a couple of other thoughts along those lines. We've had this millage rate since 2003, I believe, and it's been pretty steady. We've been able to keep it through the recession. We've been able to keep it now that we're almost in a recovery. I think sign of a pretty well-run county. So we're living within our means. My question is, this is a summer tax levy of July 1st. When do we collect it?
Well, the tax bills go out July 1st, and people start returning the funds through their local units of government beginning July 1st, but the bulk of the funds come in August and September, early September.
I think the
So-
deadline's sometime early September, if I'm
Yeah.
not mistaken.
So we have to go, my thought again is we have to go from like January to almost September before we get any tax levy in the door.
Yes.
So that hasn't changed, right? Since.
No.
Okay, thanks.
Any other questions? Comments? Criticism? All in favor, say aye.
Aye.
Opposed? Thank you very much. Item 4, Darrell.
This is a request to recommend to the board to accept and appropriate $178,200 in additional funding from the Michigan Department of Health and Human Services to the 2016 Health Fund budget, and to authorize the board chair to execute the grant agreement and approve grant extensions and changes within 15% of the original award. The Health Department has received notice from the Michigan Department of Health and Human Services that the additional grant funds are available through the Comprehensive Planning and Budgeting Contract Agreement for certain programs. Those programs include the Regional Prenatal Health Care System, $150,000, HIV prevention, $20,000, TB control, $2,200, and the West Nile virus, $6,000. The Regional Perinatal Care System will work with key staff from 9 local health departments that are part of the State of Michigan's Prosperity Region 4, as well as key partners from the region's birthing hospitals and agencies involved in early childhood efforts. The goal of this group is to complete a comprehensive assessment report of infant mortality throughout the region and complete a work plan that includes recommendations for system improvements. $35,000 in grant funds will be used to hire a consultant with infant mortality expertise to assist with data collection, facilitating meetings, and preparing the work plan. Costs related to convening a summit in June and September are $7,500. In addition, 9 health departments will receive $9,500 each for their participation. Indirect costs are $22,000. The additional $28,200 will help intensify HIV prevention efforts, increase TB services through the direct observation therapy program, and strengthen West Nile prevention efforts.
Need a motion to approve?
So moved.
Support?
Support.
Thank you. Okay, questions?
I was curious if this has an area where Zika needs to be addressed, or if, because we're Michigan, that's not, when I see West Nile, I think, okay, what about that other component?
Right. Good morning. Adam London, Health Department.
Hi, Adam.
And the answer is both. See, that West Nile money will help support our surveillance program. Right now, we do not have the mosquitoes, at least we do not think we have the mosquitoes in Michigan, which spread Zika. The surveillance program for West Nile will also seek any mosquitoes of the Aedes albopictus variety, which are known to spread Zika, which haven't been found this far north yet. However, the range has been spreading north, so it's kind of two birds with one stone, looking for West Nile mosquitoes and for Zika.
Okay, thank you.
Okay.
Any other questions? Sam and then Dave.
Thank you, Chair. My question is very similar to that. I always question these targeted funds where it seems, the state probably approved this months ago and then a new health threat comes up. I read a report where the mosquito that carries the Zika has now been found in another one, and the line has now moved up into Minnesota where this other mosquito also carries it. And it's always been a concern of mine is that, when the state targets these funds and saying it can only be used this and that, it just, as a local official, I think people agree that the locals are far more efficient in spending money than the state. And that's one gripe of mine has always been, is these targeted, so if something's targeted for West Nile virus, which is, 10, 12 years since that's been around, and then something new comes and nothing's in that.
Yeah.
In that targeted spending. It just, it's no fault of yours, but it's just the way the state seems to dictate what we can and cannot do, and that can go on all levels of the departments if you look in the county. So
Yeah, we
I
share
appreciate
those.
the work you're doing with what money you got, but it is a threat, and it's changing every day, and we seem to be just behind the ball, waiting to react.
Yeah, we share those concerns, and we're very mindful of that, especially with the mosquitoes, knowing that there are a variety of diseases besides West Nile virus they can spread. So creating an inventory of what we have in our local ecosystem is important for us.
And you know every mosquito by name, right?
We
There's
try.
about
We
5,000
try.
of them.
Thank you, David.
Following on that line concerning the state of Michigan, did you all know this was coming down the pipe in the sense that didn't the governor sign the budget last June? And so here we are in May approving a grant or the receipt of a grant. And how are you prepared to make this happen, because the money expires at the end of September, just a few short months away? And then related to that, it just says it's coming from the Department of Health and Human Services, but is this state or federal money? Do we know?
I believe it's mostly state money, and we hear about these things months in advance. So we do have a planning with the state to make sure that we have the resources to make it happen. We don't bring it forward until we actually have the e-grams transfer from the state to confirm that that money's coming.
Okay. So it's not as surprising as it seems? Like with 5
Not
months less
quite,
than
not
the
quite.
fiscal-
It is a challenge, especially with the perinatal project, which is a large project, and it's a region-wide project, which will require us to work with our hospitals and with 8 other health departments. But fortunately, we've known about that since January, when they said this was probably coming, and we've been able to work with them and communicate with them, make sure that we have a game plan to get it done this summer.
And what's the age range for perinatal as opposed to prenatal, which I understand?
Perinatal is the late pregnancy and in the early weeks after birth.
Okay.
So as you all know, our infant mortality rate is far too high across the state. These monies have been targeted in specific regions to make improvement by doing an assessment, gathering the data, finding out what recommendations could be useful for making improvements with our infant mortality rate.
Last quick question, did the other counties have such a disparity relative to race as we do in Kent County? Or is that a Kent County unique?
It's not unique to Kent County by any means. It's really a nationwide trend. It varies quite a bit from area to area, and certainly ours is very concerning in that the infant mortality rate for African Americans is about 15 or 16 per every 1,000 live births, and for Caucasians is about 4 or 5. So we've got a lot of work to do in that area.
All right, thank you much.
Thank you.
I'm going to follow up a little bit on what Dave was saying. believe me, I understand we got a problem and we need to continue to work on it, but it just appears to me like every other year we come out with a new study to help this problem, and then nothing seems to happen. And I'm not saying that maybe they can't identify what the problem is. Well, I guess they can do that. But how to solve the problem? I mean, I've had some folks say some of this is never going to be solved. But so do we just keep studying and studying and studying? And how do we get at? You understand the question?
I do, and I will say that we have made some pretty significant improvements here in Kent County with the creation of our interconception care program and the Strong Beginnings program. 15 years ago, that rate for African Americans was about 22 or 23 for every 1,000 live births, and for Caucasians was about 7. So we have come down. We're hoping to that all those lines trend down to 0. But before we can solve those problems, we need to give them a name and then organize resources in the community around solving them.
Anyone else? Matt? And then
Just a quick clarification. So we're authorizing the board chair to execute this and approve grant extensions and changes within 15%. Is that 15% of a dollar amount or a time?
15% of the dollar amount.
Okay, thank you.
A maximum of. So if we received additional funding, we wouldn't have to come to the board until it reaches that
Exceeded that
threshold, and then
15%.
after that.
Thank you.
Candace?
Thank you, Chair. This may seem like it's coming out of left field, but I will make it make sense. When I was pregnant with my son, who was almost 11, we were talking about how high the African-American infant mortality rate was. And one of the things that came up is that your high-risk clinics for both of the hospitals, or at least for Spectrum and Mercy, are not necessarily accessible by the bus line. Have you guys looked at that and done anything or put any money towards, oh gee, we got to get these ladies to the doctor? Because that seems like that would be something that would also help. Is there funds through Strong Beginnings? Is there anything that's actually helping with that transportation issue?
Yeah, it's a great question, and I know that access to health care for everyone in our community is important. In regards to that specific question, I don't know the answer right now. I will find out, and I will get that information to you.
Excellent.
Thank you. Anyone else? Thank you, Adam.
Thank you.
All in favor, then say aye.
Aye.
Opposed? Thank you very much. Item 5. Gerald, please.
This is a request to recommend to the board to approve the land acquisition project agreement as provided by the Michigan Department of Natural Resources for the acquisition of 27.4 acres to expand Millennium Park, to create the Millennium Park expansion project in the Capital Improvement Fund, and to appropriate $460,000 to this project. Through Resolution 326-1526, the Board of Commissioners approves submittal of a grant request to the Michigan Department of Natural Resources Trust Fund seeking funding to acquire 27.4 acres of land adjacent to Millennium Park. The DNR has awarded a trust grant to the county to cover up to 60%, or $276,000 of the cost of the acquisition. The DNR requires a resolution from the county accepting the terms in the project agreement, including appropriation of required funds. The final purchase price will be determined using the DNR appraisal process as required by the grant. An action request to authorize the purchase will be brought back to the Board of Commissioners when this process is complete. The agreement has been reviewed and approved as to form by corporate counsel.
So moved.
Support. Support. Questions? Stan?
Thank you, Chair. Just a quick question. The 2 pieces of property we're buying, who owns them now?
Roger, you got it?
Thank you.
The McCullough family owns them.
Okay. And then just a follow-up question, following the red and the blue lines, I'm assuming the goal is to purchase the properties to the north along Butterworth to make it all?
Correct.
All right, thank you. It's impressive in the picture, the whole park. So.
Diane?
Emily, it's all right. Do you have any, are there any special plans for this property?
If you look just south of the property we're buying, there you can see a trail network, and that's the Hanson Nature Trail, and we're going to extend that north, and also plans would be to put a 10, 20 car parking lot in there for easier access to the Hanson Trail.
Okay.
Anyone else? Thank you. Roger, on the map, where's the pavilion? Is that on this map?
The Meadows?
The Meadows, excuse me, yeah.
Go to the very east side. The entry drive, it's not on this map. It's
Okay,
east of Maynard, east of the entry.
So east of that red line on
Yes.
the right-hand side. Okay, any other questions? Not all in favor, say aye.
Aye.
Those opposed? Thank you.
16.
That gets us miscellaneous. Anyone have a miscellaneous? Dan?
Just something quick, seeing we're over the 15 minutes, I thought I'd better really go over 15. I know a lot of you people get the updates from our lobbyists and from MAC about legislation going through, and there's a lot going through, and then one thing that stuck out this past week that I read, and I got a note from the local American Legion, there was this big hurrah on how much the state supports veterans, and we gave property tax exemptions to disabled American veterans, which I thought was a wonderful idea. And I see in the package of bills that are now coming through, the state quietly, and with no hurrah, wants to eliminate that and replace it with a set amount tax, homestead tax relief. And I just think it's funny how the state can make the ruckus on what a wonderful job they're doing, but then when they do something like this, which seems there's no one's aware of this is happening, it just highlights the importance is there's a lot of stuff going on in the legislature and a lot of things that just people don't know about. And I just thought that'd be one thing to point out. If you see your legislature, ask them, why would you give them the exemption and then take it away? The other thing that I read in those list of bills, and maybe Darrell can just look into it, I see there's a bill working the way through that would allow local townships within a county to borrow money from the county, I'm assuming at an interest better than what we would get for road projects. And I was wondering if we can maybe take a look at that, what if any impact that would have on the county, anything that would benefit our local townships, or better yet, benefit our bottom line if we're the person directly lending instead of someone else. So if you just get back to me, thanks.
Okay, Gerald, do you have anything?
No.
Dave?
Say something about Thursday.
Thursday, it's up at Boulder. Well,
Egypt. Is it
Boulder Creek, the
Boulder
Gulf
No.
Creek.
No, that's Liz.
No, that's,
North Kent Transfer Station.
yeah,
We're
this
gonna
is
rename that
Thursday.
in honor of
Yeah.
Doug Wood. So,
Okay, anybody know more about it than I do?
just that it's Thursday morning, we got the email, Board of Public Works renaming that in honor of Doug Wood.
Yeah.
Who served us so well for so long and has set us up for our next phase of development as Board of Public Works. So if you're available Thursday morning, and hopefully it'll be a lovely day for a drive.
Is there public transit that goes up there?
They're not. It stops at about, I think, just shy of 4 Mile, in case you're wondering.
So we can bring our bikes.
You can bring your bikes. It'd be a lovely day for a bike ride. So, but I don't think we have any bike trails that we own up that way, but,
I'll bring my Studebaker.
Sweet. I like that. Does it look like that one?
Yeah.
Exactly. Diane?
All right, sorry. I'm going way over 15.
Emily? Matt? Candace? Roger, do you have anything? Okay, we're adjourned.
I am Kent County. I am Kent County.
I am Kent County.
We are 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 Kent County.
Peya, Kent County. Ami, Kent County.
Somos Kent County.
Mas Ira, Kent County.
We are Kent County.
We are Kent County.
We are Kent County. Oh yeah.